Okay, we're looking at another extraction and implant case. This patient was referred in 2022 with a very badly infected tooth, the tooth that had root canal therapy, a post and a crown. And you can see here the root has split and fragments of the root are separating from each other. And there's a big area of bone destruction, infective bone destruction in this area adjacent and around the root here. So we proceed to extract the tooth, clean out the area, and let it heal for about 5 months. Hi, and welcome to Modern Dental Solutions, where we handle complex and exceptional dentistry every day. Okay, it's 5 months after the extraction when this 3D X-ray was taken, and you can see the area has not healed very well despite 5 months having elapsed. This area here is still devoid of significant bone. The bone should run right across in this area here, and it's a massive defect where we need to graft in order to create a contour of the bone that is going to be reasonable once it's finished. Okay, so here about 9 months after the grafting was done, on the 3D image, you can see a very good bone contour, very good bone bulk in this area for us to place a very reasonably sized implant. And if you come up further up here onto this image, you can see where the native bone was originally in place, and you see the grafted bone. So significant bulk in the graft material in this section. And further again, if we move over to a different section, you can see the outline of the native bone, which is a little bit darker, and we have the grafted bone, which is nice and dense in this area here. And much the same on this image here, you can see good bone level and a dense grafted bone occupying that space. Okay, so subsequent to the implant placement and the appropriate waiting periods and the final crown being placed, you can see the crown here that is supported by the implant. The contour of the gum above the implant is not concave, it's nice and full and natural looking. We've got the what we call the papilla coming down reasonably nicely, and these adjacent teeth, they've had some old crowns where she's suffered some recession, but they don't show when she smiles, so that's not an issue there. But you can see from the grafting procedure, we've generated a very natural looking, naturally emerging tooth form, and this is obviously what we're after, because indeed she had not enough bone in the area after the extraction for us to even place an implant. Okay, so here you can see our X-ray 18 months. Back in February 2025 was the 18-month review, and I would review her again 2 years after that, which would make it February 2027 the next time I see her. But the X-ray shows a very nice sized implant to support the tooth, and the bone levels are excellent, so a very good result. See more of our implant and complex cases at our website or our Facebook page at Modern Dental Solutions. See you next time when we continue our exploration of more complex cases. See our other cases on our Facebook page. We take care of the entire process unless you are referred for a specific surgery or procedure. Remember, when choosing a dentist for complex work using social media, make sure that they can provide you with a diverse and abundance of examples of their work, as we do on our Facebook page. Modern Dental Solutions for all your emergency and pain relief, root canal therapy, complex dentistry, extractions, dental implants, and bone grafting needs. All photos are taken by an iPhone or a Samsung phone or a small 12 megapixel handheld camera. Photos are not modified or enhanced except for cropping and labeling.